All right, thank you. I will give it back to you. I will give it back, I promise.
No. Oh, I'm not. No, I don't think so. They said that Dennis Plants.
That's the truth.
He's the chief and it's again.
How you doing, Larry?
Good, how are you?
Good. What's new up in your area? Anything?
Melanie's gonna have
I was
you
at
down.
the firemen's meeting last week and
Yeah.
How about you?
and that's what they were talking about. Dennis Plants. He used to run
I'm
Denny's.
sick and tired of it. You know, you get a little dust, and then I go out and plow the driveway. So otherwise, it's a blacktop driveway. Otherwise, it's slippery going down my hill.
He just
So the next morning, you get up and there's another.
agitates.
You know, just enough to pack down.
He's got Dennis so nervous he's got the drizzle.
Let's get 8, 10 inches and be done with it. You know. And,
Keeps telling
Oh,
him
that-
the
oh.
sheriff is gonna run against
no.
him. Whatever. You can't do anything about it.
Oh, it's like that. I'll get my papers signed.
George, you.
Have the little rebuttal in the Argus and tell them what I think. And
Well, you can't do that.
why? Well, I could.
You can't tell him what you think.
Well, all right.
Hey, Everett,
Yes, sir.
did you hear the good news? Bill Hague's running against me.
Consider that good news.
Well, you guys might be blessed with it with good.
Oh, God. Don't like me.
Oh. Dennis said he was having rotator cuff
Yep.
surgery today.
Today. If you need help with your campaign, I'll donate.
I'm not gonna even. I probably won't even go see anybody.
Come on.
Yeah, maybe I know if I see him.
He's gonna be out there beating the bushes.
Everybody should know what he's about. If they've been there any length of time.
You only lost by 3 votes last time.
That's all I got beat by.
No, because if there's only two on two, you know, I don't know if anybody else took out any. If there's going to be three or not.
Right there by before Lakeshore.
Well, I got the village of Wild Rose and part of town of Rose and all of Springwater. So I got 3.
I got most of Richford, not all of it. Dakota or Deerfield and part of the
Yeah, didn't they have a little dance hall or something in the back?
But you know how it was when he was on last time.
Daughter had her wedding.
for a while and then 3.
Okay, it's 7 o'clock. Let's call the meeting to order.
Close enough to.
Mel will do roll call. Mrs. Krentz. Mr. Heisey.
Here.
Mr. Tim.
Here.
Mr. Piaski.
Here.
Mr. Eckstein.
Here.
Mr. Weddy is absent. Mrs. Collada. Here. Mr. King.
Here.
Mr. Radel.
Here.
Mr. Crawford.
Here.
Mark Kirschner.
Here.
All right, thank you. We will now have the silent prayer and pledge of allegiance, please. I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, we're doing public comments, and I have one today, and that is Deb Padula.
Good evening. I just wanted to take a quick minute to let you know that we recently just finished our 3rd cookie sale, which is part of a fundraising effort for the kitchen. Some of you here were in the kitchen helping us with that. And we raised just shy of $4,000, which I think is pretty impressive. Over 10,000 cookies baked. Thank you to all of you who helped eat some and over the past few years, the pounds that we put on trying to support that kitchen. But I just wanted to report that we with this fundraiser and with the money that has been donated this year, which was an additional $3,000, we are paid in full. The kitchen is paid in full. So I think that's pretty remarkable. In just under 2 years, we'll celebrate our 2nd anniversary on February 1st. So I just wanted to thank you all for your support of it and let you know that we reached our goal. So thank you.
sale, and they worked really, really hard on those cookies, so. What? Actually, they don't let me do the baking because I melted my plastic apron last year. So I don't get to go by the oven anymore, so I didn't eat any. No. Okay, let's have an approval of the agenda, please. Motion by Waito, second by Larry Crawford. All in favor?
Aye.
Opposed, same sign. Approval of the minutes of the November 12th, 2013 monthly meeting and the 2014 budget public hearing.
I'll make a motion that we,
Motion by
Second that.
Bernadette, second by Everett. Is there any discussion, question, Larry?
I believe that the minutes are incorrect. I don't know where, let's see. On page 2. My recollection that, as I seconded the motion, that we amended the motion on the amending the rules and bylaws of the County Board of Supervisors. The decision was that we would not pay for any meetings that were not agended. And that's not the way this is written.
It should be that we pay for the ones that were okayed by the chairman of the committee. I don't have my minutes with me, Larry.
I looked at the, I rewatched the board proceedings that we tape every time, and there was originally an idea that wording should be added to the first two sentences, and then that was decided it wouldn't be that way, and then it was, I recall that it was just the first two sentences were what we were going with. Ruth, do you remember what that was? Or did I not hear correctly or listen correctly?
I guess I have to go get my copy of the bylaws that I wrote on that one. But I can have to see it. I guess for sure, I have to, I'll be back to my office to go find my notes from last month.
Because there were a bunch of different suggestions.
Thanks, Ruth.
Ruth to get back then so we can settle this.
Anything else? Anybody see anything else?
Oh, yeah. It's this section right here. Does anybody else need the minutes?
Someone who can entertain us all the way.
Would you like me to sing like Have a Holly Jolly Christmas?
What I have in my notes is that in paragraph 7, everything was struck, but the first and second sentence So it should read, committee chairpersons may authorize committee members to attend other meetings related to the business of the committee. Members so attending shall be paid their actual necessary expenses in addition to their per diem payment for attendance at such meetings, period. And then nothing else. And that it would just be that Deb's would not be checking it. She would just pay whatever was submitted.
If you still have questions, maybe you can come in and see Mel and look at the tape, you know, if you still have questions.
I wouldn't have seconded it this way.
I guess point of order then, do we need to put it back on the agenda, Ruth, for the next meeting?
Because it was my understanding that there weren't going to be any per diems unless it was an agended meeting.
That's the way it started.
That's the way it started, and then the draft that came from the executive committee took out the agenda and said that there had to be approval noted in the minutes, and that on your per diem sheet you had to note the date of the meeting where the minutes were in, and then that was all crossed back off, and then adding with a presentation of agenda started again, and then I have that written down with presentation of agenda, if no agenda, comma, and then that was crossed off, and then it was all. We did talk about it, but I had it crossed off. So I guess that we can bring it back in January, and I'll look at the video and.
What do you remember, Everett?
I remember the way it's written in the minutes, as far as that if the chairman of the committee okayed the meeting, that we would get the per diem for it.
It's not the way I remember it, but
Let's,
Why don't we amend the motion to delete that portion of it and bring that back next month? Will that work?
I don't know what you want me to delete now.
Well, the county board bylaws revision. The part that's in here about what Larry's discussing.
Oh, in minutes.
In the minutes, correct, yes.
so,
We need a
We vote?
motion to that effect?
well,
No, but we need to vote on the motion.
yes.
Okay.
Yeah. So, all in favor
what are
of
we
the
doing?
motion, of the way it's written? And if you don't wanna, if you say no, then we'll bring it back, but we have to vote on, you know, cause there was a motion and a second, and we have to vote on that.
Right, to approve the minutes. So if you don't want to approve the minutes, a no vote says, no, you don't approve of these current minutes. A yes vote says, yes, you approve of these current minutes. Whether you approve of the minutes or not, we can still bring the bylaw section back in January.
Then I'll move that we table it.
Done on another motion. If we wanna bring the bylaw, the question bylaws back, right?
Larry just made a motion to table.
But don't we have to
Yeah,
vote?
we have to-
we gotta take care of the
There's the motion on the floor.
Yeah, we have to finish
When
this.
they make a motion to table, doesn't that impact it?
A motion to table supersedes anything else.
Yeah.
If there's a second of it, and then that would,
Yeah, if there's a
that would
second.
take precedence over your motion to approve.
Mhm.
So if Larry makes a motion to table, somebody seconds that, and your tabling is the approval of the minutes?
Right.
Okay.
Alright, we have a motion by Larry to table the minutes of last month's meeting. Is there a second? table. All in favor?
Aye.
Opposed?
Aye.
Aye.
You gotta hand raise or something. Should I just roll call it? Okay, roll call it.
Yes is to table. No is to let everything go through the way it is. No. Not to table, and then we would vote. Okay. Okay.
I'm so confused. So motion to table, Mrs. Krantz?
Yes.
Mr. Heisey?
No.
Mr. Tim?
Yes.
Mr. Piaski?
No.
Mr. Eckstein?
No.
Mrs. Claudia? No. Mr. King?
Yes.
Mr. Waito?
No.
Mr. Crawford? No. Mark Kirschner?
No.
By Everett to approve the minutes of last month's meeting. All in favor?
Aye.
Opposed?
No.
Thank you. All right, we have no old business, let's go to new business, and we have some reports and presentations tonight. And the first one will be from the treasurer's office, and Elaine Waddle will do her annual report.
Good evening.
Good evening.
I'm here as County Treasurer to present a brief overview of the County Treasurer's office and duties involved through December 2012. Our office staff included Elizabeth Corning and Jean Armstrong, and Betty retired earlier this year, and Jessica Yeager joined our staff in March. The Treasurer's office is located on the north end of the first floor of the courthouse. The primary functions of the office is to collect and receipt all monies received by the county from taxes and from various other departments. All the deposits are brought to the office, and they are verified as to correctness of the amount, and the cash is checked for counterfeit. All checks in the deposit are verified as being correctly written with the date, amount, and signature being before being processed. Each day the receipts are balanced to the printed cash check deposit summary, and the deposit is ready to be taken to the bank by an officer from the Sheriff's Department. The number of receipts processed from the department varies each day, and the number of tax receipts for postponed and delinquent taxes processed through August of each year is over 10,000. There will be a breakdown on the next slide, but we'll go on. On September 1, certificates or liens are taken on all current year taxes that remain unpaid. Certificate notices must be mailed for each parcel that is not paid. There is always an overlap of what is the current year taxes and those that are remaining delinquent or unpaid. And so the collection process is always ongoing. An accurate record of payment on each parcel as well and the delinquent parcels must be recorded. There are over 30,000 parcels in West Shore County. Delinquent notices are prepared and mailed in April, which was over 1,000, and in October, again, we sent out notices of about 800. Monthly reports and payments are made to the state of Wisconsin for sales tax, sales and use tax, circuit court fees, fines, and real estate transfer fees. Quarterly probate birth fee reports, payments, and annual report payments for dog and marriage license are prepared and sent to the state. Every 2 weeks, our office distributes and or mails the payroll checks and the general voucher checks. An investment report is prepared and provided monthly for funds invested. A majority of the funds are in CDs with local banks and in the state of Wisconsin investment pool. Daily access to online bank information is valuable to ensure accurate banking records, including incoming ACH deposits and payments, and to be aware that there is a available balance for the general purpose in the departments. If a department needs an image of a canceled check, it can be printed and provided to that department through the online banking. Interest rates continue to decline, which has significantly decreased interest revenue. Okay, this is the breakdown of the tax receipts processed each month and the amounts.
Elaine, could you explain a little bit to the board about the tax settlement process?
Okay, I have that later on in the.
Awesome.
Yes, that would be that tax settlement that are done in February. Okay. Okay. Bank reconciliation is prepared for all the accounts. We have an HRA account, a CDBG account, and then the county's working account. It's monthly, and the reconciliation is done to ensure the accuracy of bank records with the county clerk's cash balance. A written report is provided to the executive committee for the county's working account. The bank statement and check images are provided on a compact disc so that the paper checks are not returned for storage. A valuable asset is the internet access to the county's account via the bank's banking portal. This portal allows the accounts to be viewed at any time to verify the status of checks and print check images of the canceled checks, and verification of the ACH credits to various departments such as EMS, Human Services, Health Department, and even interest earned by the counties on the county's investments. There is also verification as to outgoing ACH payments, such as the sales tax payments, child support, Department of Human Services, and federal and state withholdings. And the online banking is also used for direct deposit for payroll. We also do the tax deed foreclosure. The office works with the executive committee in arranging for the sale of properties, and all the preliminary research and preparation of tax deed foreclosure is done by the treasurer's staff. With the commencement of the foreclosure action, newspaper publications, certified mailings are prepared. Preparation of notices have to be sent by certified mail, and there's necessary publications and affidavits of mailing. The county then hires a title company to perform a title search, and after the expiration of 90 days notice, a resolution is presented to the board, at which time a county tax deed is prepared and recorded. The county hires an appraiser to give an accurate value, and the publication of a Class 3 notice, conditions of sale, bid forms, and are mailed to prevent potential purchasers. Sealed bids are opened by the executive committee, at which time the bids are either accepted or rejected. When accepted, notification to the successful bidders are mailed. Collection of the funds from the sale are receipted, and a quitclaim deed and transfer return are prepared. At this time, the final calculation of expenses, taxes, and funds is prepared. Once the action begins, There are multiple people involved, including the corporation counsel, county clerk, Scott Schuman, who always secures and views the property, puts the for sale signs out in the buildings and grounds, who maintain the properties, and also shows to any the properties to interested parties. The first dollar credit was created in 2007 legislator, and that is a credit on the tax bill for all improved properties. And the report is filed and produced. It's sent to the state of Wisconsin by March 1st of each year. For 2012, we had 16,112 parcels for a total of $920,575.95 of credit that are received and receipted in July and as part of the final August settlement. The Treasurer's Office also administers a lottery credit for all qualified improved properties, as well as monitoring changes in ownership of improved properties, and directly determines if the property qualifies for lottery and gaming credit. The qualifications for lottery credit is you must be the owner of the property and use the property as primary residence as of January 1. A primary residence is where you live most of the time, and when you are temporarily away, it is the home in which you intend to return. You can only have one primary residence, and the credit cannot be claimed on a business, rental, land, garages, or other properties that are not your primary residence or by a non-Wisconsin resident. The process of maintaining and updating the lottery credit is ongoing and cumbersome due to the changes in ownership and construction. All newly eligible homeowners must be certified each year, and the Treasurer's Office is responsible for mailing out lottery credit applications for the current tax year, as well as late applications for the previous year. Both applications must be signed by the property owner and returned to the appropriate office. Once the signed application is received, the office then posts the entries to the eligible parcels so that the credit will be applied on the tax bill. Property owners currently receiving lottery credit on their tax bill are no longer required to recertify. The applications are valid until the property no longer qualifies as a primary residence of the property owner. The law requires notification to the County Treasurer's Office within 30 days if the parcel no longer qualifies as primary residence. The Wisconsin Department of Revenue does a periodic audit of claims to verify failed credits. If a failed lottery credit goes unresolved, it is then placed on the tax bill as a special charge. The lottery credit process requires an additional settlement with all taxing jurisdictions, and the office receives and receipts monies in April, and then a settlement is done by April 15th of each year. For the 2012 year, the settlement consisted of 7,706 parcels receiving the credit, and the dollar amount was $616,430.73 that was settled. And the next slides show this is the first dollar credit in comparison to 2011 versus 2012. So they're actually running pretty close together. And I think the next slide is the lottery credit, which is also very comparable. this is the tax settlement.
All right, thank you.
All right. Every start of the new tax season, we have an annual meeting in October or November with the municipal treasurers and the GCS software company to prepare and review collection procedures and updates. And the treasurer's office works closely with the municipal treasurers and officials during the tax collection process. And we, as well as the real property lister, provide information and assistance regarding a request on a divided parcel. A settlement for the dollars collected by the municipal treasurers in December is prepared by January 15th, and each taxing jurisdiction receives payment for a proportionate share. The municipal treasurers continue to collect through January 31st. The county treasurer then settles with each entity, the school districts, special districts, municipal, vocational districts, town, and municipality in the county for their respective tax rolls by February 20th of each year. The lottery credit is another settlement which takes place. After the settlement with the municipalities, the treasurer's office produces a report or a file which is uploaded to the state of Wisconsin Department of Revenue by March 1st. The county pays the state of Wisconsin Department of Revenue their share by March 15th. The county treasurer makes a final settlement of each tax roll in August of each year. Distribution is made by the county at this time to each municipality, special district, school district, state of Wisconsin, and for the county's portion of the tax roll. Our office works closely with local treasurers, state of Wisconsin Department of Revenue in an effort to coordinate the collection and disbursement of each tax roll. The ever-changing laws in the area, in this area, makes it a quite challenging job. Another area that we deal with is the use value conversion charge. That is a charge for converting farmland from agricultural to non-farm use. And the charge is imposed to those who change the agricultural property. The charge is the difference between the average market value of cropland sold in the county and the use value amount of the land. The use value conversion is applied at different rates based on the number of acres converted. The office is notified by the assessor of the classification change and the number of acres change, and we are responsible for the administration of the use value charge. We have prepare a letter to the person changing the use, and the charge is imposed as well as the instructions for payment. The county collects the conversion charge and distributes 50% to the taxation district, and 50% is retained by the county. This is a day in the office of the treasurer. On a daily basis, there is a volume of telephone, in-person inquiries for tax parcel information from attorneys, realtors, abstractors, banks, and the general public. Current tax information is accessible via the county's website. The new web portal now has current payment information as well as new GIS maps available, and soon payments will be made by credit card via the new web portal. The new web portal is very useful and helpful in our office as well as to the general public. And We will continue to work with local and county, state government in an effort to serve the public through the functions of the treasurer's office.
That's cute.
Just a correction, the use value conversion charge doesn't apply to all changes of farmland. It only applies if you change it to residential or commercial use.
Commercial use, right. Yes, if you're changing it to those classifications.
And
That is correct.
when does it change?
Pardon me?
When does it change?
When does it change? The assessor notifies us if each year of the changes when they,
After board of review.
after board of review, yes. Yes, thank you.
I have a question because there was a question brought to the city about an area that was a subdivision and some people are paying agricultural on certain lots and some people are not. So I was wondering who would answer that question, why it's different.
If it's used for agricultural purposes, a crop is taken off from it, hay is cut off from it, or crop is planted on it, then it qualifies for agricultural use value,
It continues to be,
even if it's a residential lot.
as long as it's producing ag products.
What if it isn't?
Pardon?
What if it isn't and there's still?
Well, then the assessor
That's that way.
needs to,
The assessor would be the person to contact,
needs
okay.
to notify us and we will do the conversion charge.
Any other questions? Thank you, Elaine. Appreciate it. Right, next we have the Sheriff Department Annual Report.
Good evening. George Peterman was going to be here tonight, but last night they lost their family dog and his daughters are taking it quite hard, so he has stayed home with them to try to help them through that. So we've got a committee here tonight to give you our report. We have a report for both 2012 and up to the date here for 2013, so that's why we have the two figures. Our communications center, the dispatchers have taken a lot of calls for 2012. There was over 17,000 calls they took, and as of a couple of days ago, they were up to 16,296. Of those calls, 2012 they had over 1,200 emergency 911 calls, and this year that figure is up over 2,235 as of 2 days ago. The emergency 911 calls are the calls that dispatchers stay on the phone with the person as long as possible to maintain contact, and that's why we've got those denoted as different. These are crimes that are reported through to the state and to the FBI, and Randy will have some more figures on some other crimes that kind of fall outside of these areas. But these are the ones that we investigated in 2012 where, as you see, the biggest ones were thefts, forcible rapes, robberies, assaults, as you can see there. And then for 2013, we did have the murder, and that's the murder that occurred up in the Mount Morris earlier this spring. Again, you can see the numbers. Again, the thefts are extremely high. And go on. A civil process. This is one of the areas that takes a lot of time and involves a lot of work for everybody. But the civil process are papers such as summonses, replevins, other paperwork that the deputies go out and serve public. And as you can see, for 2012, there was up over 1,100, and we're not too far behind right now this year. Crash reports. Our deputies handled 324 crashes in 2012. So far this year, we're up to 307. And in addition to those, we also handle a large number of car-deer crashes. And as you can see, in 2012, we had more car-deer crashes than we did people running into each other or running into other objects. citations and warnings. This is what our people have issued for 2012. We had 2,100 citations. For 2013, we're up over 1,800 warnings, a fair amount of warnings for each year. Jail report. The average jail population, the average daily population, or EDP as George calls it, for 2012, we averaged 72 inmates in the facility for the year. 2013, that's up to 81 inmates, and then we have the breakdown of the two genders. Bookings, this is what, as a person comes into the jail, this is the what we call the booking process, where we register them into our hotel, if you will. And for 2012, we had 1,084 bookings, and we show the breakdown between the genders there. Of those bookings, we broke it down into new arrests. Those were 545 people that were arrested and brought in, booked into the jail for a charge that happened at that time. There were 214 people that were booked in to serve their sentence after they were adjudicated in court. PO holds, or probation office holds, those are people that are on probation that violate the rules with their agent, and their agent has them held in our facility. And there were 153 people that were booked in on warrants that were issued by the courts. Summons and returns, there were 73 people issued, or that booked in for those. 2013, again, shows the numbers so far as of earlier this week. And we had the breakdown of those bookings for this year. Jail staffing, there are 4 positions that are set up for the jail, and in 2012 we were staffed with 3 officers at 82% of the time, and then in 2013 we're staffed with 3 officers at 84% of the time. So it gives you an idea of what we have there. Now I'll turn it over to Tim, and he'll give you the emergency management report.
This is the 2013 emergency management plan of work review. For 2013, in our planning process, we reviewed and completed ESF 1 to ESF 15. Those are the emergency support functions for the emergency response plan. We also completed a brand new emergency response plan that was promulgated by the county board back in March. In going along with that, the table of contents was updated and completed. The legal basis of the plan was reviewed and approved by Ruth. During the first half plan of work, I began work on the crosswalk to CPG 101 version 2, which made the plan compliant with FEMA guidelines, and then began review of the Waushara County All Hazards Mitigation Plan for update, which expires in 2015. I submitted the sub-grant planning application for the county, and then finished the crosswalk to CPG 101 version 2 as the ERP was completed. In the regional planning field, we worked and continued work on the interoperability emergency communications plan with local police departments and fire departments and EMS. We worked on the county's tactical interoperability plan, and that continues to be worked on yet in the 2014 plan of work. And we updated the NIMS equipment resource list, and that is a list of NIMS compliant equipment located throughout the county, not just with the fire departments, but within the municipalities that we would have at our disposal if a disaster occurred and we needed to look for that type of equipment. Our LEPC plans, off-site plans were completed for Seneca Food Corp, Hancock Agricultural Research Station, and the Village of Wild Rose Wastewater Treatment Plant. The update to the countywide strategic plan was completed, and new off-site plans were completed for CenturyLink and Magnum Products. Part of the emergency management function, we updated with the assistance of the Village of Wild Rose their emergency response plan. I attended and participated in training through the Emergency Management Institute's independent study. Our exercising we exercised with the Westfield School District and assisted them in the development of their school safety plan. We've begun preliminary discussions with the school districts within the county about a county-wide school safety plan. Participated in the ice storm power outage for Northeast Wisconsin with the Department of Public Health, and then participated in the FBI active shooter tabletop. Our outreach to the community, we trained 25 severe weather watchers in April. We implemented the Code Red emergency mass notification system, participated in the statewide tornado drill, assisted the school resource officer with the STEP program presented to 5th grade students throughout the county, participated at Blue Ribbons Kids Day, assisted in setting up weather radios at the senior meal sites, and worked directly with camp directors throughout the county to set up and give them some basic templates for developing safety plans for their facilities. Our EPCRA outreach, again, our site visits to Seneca Foods, Hancock Ag, Wild Rose Wastewater Treatment Plant, and Crop Production Services. We have met with Crop Production Services on 2 occasions now, and we'll be exercising at their facility in the near future for a functional and a full-scale event. And we met with Leach Farms about the fuel tank location that they have on their property that needed to meet DNR approval. Our LEPC administrative requirements, we published the annual EPCRA public notice back in January and are preparing to do that again for 2014. We updated the current EPCRA LEPC membership list. We conducted our regular LEPC meetings, updated our EPCRA LEPC bylaws, and we reviewed the EPCRA database in the state's WHOPRs program. Our plan of work and disaster grant administration requirements. I attended all our regional meetings. I prepared the incident action plan for the Waushara County Fair. I printed the NIMS cast information from FEMA, prepared and submitted this year-end report, and performed damage assessment from the August storm that damaged parts of the northern part of the village of Wild Rose. Waushara County Emergency Management continues to work with all county agencies to adopt and foster long-term working partnerships to assure that all the county's residents' needs are met if the situation arises. Local elected officials will continue to be encouraged to develop and implement their own emergency response plans to meet the needs of their communities, and we will continue to do numerous outreach activities to meet the needs of our communities and to prepare them for disasters and respond to assist them when needed. Thank you.
Okay, for those of you that don't know me, I'm Randy Thurley. I'm the Detective Lieutenant at the Sheriff's Department. I just have a few numbers. You saw some numbers that were up on the screen as far as sexual assaults and those types of things. Those numbers are a little skewed. Them are the UCR numbers that actually go down to Madison. When Human Services and Crisis gave their report to the county board, I was here for that, and when they said that we work a lot together, we work a lot together. I am the liaison between the Detective Bureau and the group over there. So in 2012, in getting numbers from Ruth, we had 57 mental transports that we had from the crisis, and that would be those 57 transports were people who were brought into our office. They were seen by an intake worker. Arrangements were made for them to go to a hospital. Before they get to go to that hospital, they have to go for medical clearance. So we'll call somebody in, they'll take them to the hospital, get medical clearance, and then they go to the facility where they're going to be held until the court appearance, and then we bring them back for their court appearance. So, and statutorily, we are bound to do that. We have been utilizing the municipalities. If one of the municipalities bring in somebody that needs to be seen by crisis, and a commitment is decided that needs to take place, it's the municipality's responsibility to get the medical clearance. So we have them go to whatever hospital that they're gonna make arrangements with. As soon as that, client is medically cleared, then it's the sheriff's responsibility to take that person to the facility where they're gonna go. And then it's our responsibility also to bring them back so that they can go through the court system. So we had 57 of those in 2012, and to date, we have 47. I'd like to tell you that we're going to be below last year, but we're coming into holiday season, and this always seems to be a busy time for us because of people with the lack of funds, lost loved ones during the holidays, whatever it is, and it seems like our numbers always increase between now and January 1st, so that's just going to be an estimate number for you guys for 2013. But there again, you know, it's a time-consuming venture. We do use special deputies as much as possible to do the transports, so that we can maintain our road staff. We have a group of special deputies that know where they're going, they know how to handle these types of situations, and they'll take care of the transports for us, and they get paid an hourly wage for doing so. So that would take care of the mental commitment issues. The other thing I want to bring your attention to that didn't show up in the report, in 2012, there were 42 juvenile sexual offenses that were reported to the Detective Bureau. Now, every one of those that come into our office, we have to investigate by statute. Now, that doesn't necessarily mean that all 42 of them are going to be charged. It doesn't necessarily mean that all 42 of them are going to be where someone's going to be held accountable. It depends on what we get for a report. A lot of times we'll get the RP said, and then we will go and talk to the names of the juveniles involved, and either they won't cooperate with us or they do cooperate with us, and then if they don't, there's nothing we can do. We don't have a complainant. So, but every one of them that come across my desk is assigned to a detective for follow-up, because by state statute and with our MOU that we have with Human Services, that's our obligation. We do all sexual assaults that come into the county. So if it happens in one of the municipalities, we have it worked out with the district attorney's office where the district attorney wants us to do that type of a felony case. So we don't pass them back to the Village of Plainfield or the Village of Red Granite. We historically will take those and take the ball and run with them. So, and then we had 3 internet crimes against children cases in 2012, and that would be the child pornography stuff that you're getting on the internet. That these numbers would not include the ones that the Department of Justice come in and do. These are the ones that we've done in the Detective Bureau. 2012 was kind of the beginning of where we were at with those. We start getting into 2013. That changes a little bit. Rolly's not here. Autopsies in 2012, we did 1 autopsy. And autopsies generally are discussed between myself, the coroner that's on duty at the scene, and the district attorney's office. And there's a determination as to whether or not there's going to be an autopsy that's needed. And if there's an autopsy that's needed, a majority of the time, an officer will escort the person down to pathology and will attend the autopsy. We do have it worked out with funeral directors that if they do not have anybody available, we will take their van with the person in it, and we'll drive down there, and then we just bring the van back to them when they're done. So that was in 2012. 2013, we had 56 juvenile sexual assaults. Tends to go up. It depends on the year, and it's kind of like with the school resource officer, which schools are you going to have the most trouble with. That kind of goes by the year. It seems like one school district will be a problem this year, and then on next year it's another school district. Well, it's the same way with the sexual assaults. They tend to fluctuate depending on what's going on, and how much information is being put out in the schools to encourage the children to report them. And there again, 56 of them come in, all 56 of them have to be looked at. I don't screen out any sexual assault. Everything is handed over to a detective. Some of these we will work with Human Services if they're a caregiver. But I can tell you that Dawn and Lindsay have been phenomenal, allowing their staff to help us do the interviews of the victims. It's a lot of the victims are females, young females, and younger children. And we utilize their interview room, and they offer up one of their staff members to do what's called a stepwise interview, because that's what the state mandates is a stepwise, and so that you're not trying to encourage the child to tell you something that didn't happen. And we have this program, this situation right down to a T. Dawn, when she gives it to me, she'll put a note on, if you need somebody to do the interview, give me a call, we'll set something up. And then we do all the suspect interviews. So as far as internet crimes against children, our office itself has 10 in 2013. We have 2 that are currently active that we're working on right now that are coming from other states. With the use of some of the computer technology, you never know where that person is going to be from. We are working with 2 other states right now to try to take care of the problem. One of the individuals that we have in custody right now, he has state charges, and to go along with the state charges, he had his case is so significant to go along with sexual assaults and the manufacturing and distribution of child pornography right here in the county, that the U.S. Attorney's Office out of Green Bay is actually looking at charging him, and that would be a 15-year minimum mandatory if he was to go to the federal system after he gets done with the charges that he has here. So that was recently set for jury trial. So 2013, been a bad year for the coroner's office, 13 autopsies. I think when we did the budget last year for 11. We're at 13. We are not at the end of the year. I can tell you that of the autopsies that we do have, that none of them were autopsies that were not needed or warranted. That would include triple fatal that we had out on the interstate for each person that passed on that case. We had autopsies we need to cause of death because we are investigating that as a homicide by intoxicated use of a motor vehicle. We had one out right away in January of this year. We had one just outside of town out here. That gentleman was just convicted and sent to prison. It would include the homicide in March, and then I believe that number also would include the incident that took place on August 14th for the autopsy for the young man that was involved in the officer-involved shooting. Other than that, I think that's all I got. Anybody have any questions, comments, or concerns? Everett.
Special officers, are those sworn officers then or not?
The officers that we use to do the transports for the commitments, they are not. They're special deputies. We have several special deputies, but there are a handful that we'll use for transports to and from court, picking up people up on warrants, that type of thing. One of them's the retired chief from the city of Watoma, and a couple of the other ones are retired corrections staff that we had that wanted to come back and help us out and do transport. So they're familiar with the system. So you're welcome. All right, thank you.
Thank you.
All right, next we will have a community health assessment, community health improvement plan. Patty?
Evening. Hi. every 5 years, the Public Health Department has to do a community health assessment and improvement plan. The point is to look at what the health issues are for your community and decide what you need to do to fix those, if at all possible. And this is our latest, 2013 to 2018. I'd like to introduce our AmeriCorps member for a year. This is Pa Chang. Our AmeriCorps member, prior to that, you might have met her, Bridget Daly. She did a lot of work on our community health improvement plan, and Pa has done an immense amount of work since she's come to us. She'll be with us until August. So we're going to go through this as briefly as we can for you, to not take up too much more time for you tonight. I know that my board has seen this, so they're going to bear with it and see it for the second time. So I'm going to have Pa take you through our community health improvement plan.
Okay, we can go to the next slide. All right. Okay, so for our whole process, evidence-based practice was used, and we collaborated with community partners and different stakeholders in the community, and everyone was actively involved with the coalition and the work group meetings. We started off with the needs assessment, and we completed a community health needs assessment when Bridget was here, and they handed out over 300 surveys to the community. The survey allowed residents to provide input to identify the top health issues in Wishara County. And then after that, we prioritized the issues and chose our focus areas based on the surveys, the mortality data, as well as the Healthiest Wisconsin 2020 goals. And the coalition also considered what was achievable, what was available, and what other organizations and coalitions are addressing. After that, we developed an action plan, and community partners reviewed the data, the primary and secondary data, and then developed goals and strategies to target the areas that needs the most improvements. And an action plan was then created. After that is the implementation stage, and that's where we are right now. And we are working hard with our work groups to implement the action plan. And throughout the whole process, we are always evaluating, monitoring, and revising the plan and work plans. Okay, so based on the criteria, the Wellness Coalition decided that the 3 focus areas are chronic disease and access to healthcare, mental health and alcohol and other drug use, and then physical activity and nutrition. Okay, so these are just graphs on why we chose those focus areas. And this one is chronic disease, and this graph is on the top underlying causes of death in Wishara County for 2010. And as you can see from the chart, heart disease and cancer are the 2 top causes of death, and those are chronic diseases. And then this is the number of deaths per year due to stroke or cerebrovascular diseases in Wishara County. And our rates were decreasing, but then in 2010 to 2011, there was an increase in deaths. And then these are the numbers from 2005 to 2011. There was a total of 78 deaths because of stroke. And then in 2010, there were 94 hospitalizations and 77 deaths due to coronary heart disease. And 10% of residents aged 20 and above in Wishara County have diabetes. And in Wisconsin, 8% of residents aged 20 and above have diabetes. And then for our chronic disease goals is to increase early access to emergency care, improve the quality of life through prevention and management of modifiable risk factors associated with chronic disease, and to improve health-related quality of life by mitigating effects of chronic illnesses. And our action plan is to develop and implement a public awareness campaign for stroke, increase the businesses in the county that has an AD defibrillator and has CPR certified staff. And we also plan on decreasing the EMS response time to less than 14.59 minutes, as well as Wild Rose is planning on identifying their baseline disease management data. So for that, we are looking at cervical cancer, mammogram, and colon cancer screening numbers. And we also plan on improving the completion of Stepping On and Living Well classes through the Aging Disability Resource Center, and that is for fall prevention. We are also planning on implementing one Healthy Living with Diabetes class through the ADRC, and increasing the number of people attending the American Diabetic Association Diabetes Education Program. And lastly, for the action plan, we plan on increasing the public awareness of benefits of the cardiac rehabilitation program. So what we have accomplished so far is EMS is planning their hands-free CPR presentation at a local high school basketball game, and Hancock passed county board, but I think as of right now, it's still on hold. And EMS is still monitoring their monthly response time, and what they found out is their response time is actually less than 14.59 minutes. Wild Rose has updated their health screening data, and the Healthy Living with Diabetes class was on October 21st to November 25th of this year. And then the next one is access to healthcare, and 14% of Waushara County residents under the age of 65 are uninsured. And for the graph, this is from the Community Health Survey, so all of these numbers are self-reported, and according to the survey, 100 people has no health insurance or is paying for health insurance, is paying for care through just for cash. And then this graph shows how Wild Rose Community Memorial Hospital patients are paying for their health care, and 11.4% of their patients are paying out of pocket for their health care costs. And this is just a graph of Wisconsin. The shaded area represents the shortage of healthcare providers. The one is for mental health and one is for dental, and as you can see, Waushara County is in the shaded region for both, so that means that we have a shortage of mental health and dental care providers in Waushara County. And then this is just more numbers to show the shortage of healthcare providers in Waushara. We only have one primary care physician to every 3,062 people. We have one mental health care provider to 3,499 people, and we only have one dentist or dental hygienist to every 2,450 people. And the Wisconsin rates are just below those, so they have more healthcare providers per people. And our goal is to ensure that all residents have affordable access to comprehensive patient-centered health services. Our action plan is to increase the awareness of the Affordable Care Act and the health insurance marketplace, as well as to develop strategies to increase healthcare access. So what we have accomplished so far is resources from CMS, which are brochures and flyers about the health insurance marketplace and the Affordable Care Act, were made available to the public. All of these resources are at the health departments, and they are also at your local libraries and at the Aging and Disability Resource Center. We discussed the strategies on ways to increase the healthcare access in our work group meetings, and what we came up with was the Security Health Plan grant to increase health literacy and access to the certified application counselors, but we didn't get that grant. But we were still able to develop 3 town hall meetings with the help of the UW Extension and the Partnership Community Health Center at Appleton. And next is the mental health and alcohol and other drug use focus area. So this is the alcohol-related motor vehicle accident injury rates. And as you can see, Wisconsin rates are lower than Waushara County in 2010. And then this is the prevalence of binge drinking among adults aged 18 and over. And from 2006 to 2011, 21% of adults aged 18 and over were binge drinking. And this has been increasing over the years. And from 2008 to 2009, 192 drug-related hospitalizations were for every 100,000 people. And this number increased to 217 per 100,000 people in 2009 and 2010. And then the Youth Risk Behavior Survey, which was completed in 10th and 12th graders at the Waushara County High Schools, 11% of the students reported that they have seriously considered attempting suicide in the last 12 months. And 1 in 5 students reported that they have felt sad or hopeless almost every single day for 2 weeks or more, that they stopped doing their usual activities. And this is the suicide rates in Waushara County, and the rates were the highest in 2009, and they are still decreasing, but in 2011 we have 4 deaths because of suicide. Our goal is to reduce unhealthy and risky alcohol and other drug use, and to promote early identification of mental health needs and access to resources. So our action plan is to develop mass educational campaigns on mental health and alcohol and other drug use, as well as to implement and increase community-based effective alcohol and other drug use prevention programs. We also plan on increasing the dissemination and awareness of information available on mental health and accessible services in Waushara County, and to increase the education of professionals in regards to direction leading to policy change. So what we have accomplished so far is an article was put into the Argus on Drug Take Back Day. Posters and flyers were given to local pharmacies to distribute to their clients. And Waushara County was awarded the federal CAPS grant to expand there, but that's still on hold. And then the social host ordinance is passed and was in effect as of October 1st. And Prime for Life is an educational campaign to to decrease drug and alcohol use in the county. And in December, this program started in Watoma High Schools. In Wild Rose, their program will start in January, and we are still planning for Tri-County School District. Next is the physical activity and nutrition work group focus area, and this is the percent of overweight and obese people in Waushara County. And as you can see, overweight and obesity is increasing. And then this one is the adult obesity compared to Wisconsin, and the adult obesity rate is increasing, and our rates are higher than Wisconsin. And then this is the food security rates in Waushara County. A household is considered food secure if they have ready access to food that were safe and sufficient to satisfy their nutritional requirements, and they were able to purchase their own food. And a food insecure house means that if access to safe, nutritious food was limited or uncertain for at least one person at some point during the year. And very low food security is if one or more person in the household reduced their food intake or had to change their normal eating habits during the year because of the lack of money or resources. And from the graph, food insecurity has decreased, but very low food security has increased over the years. And this is the percent of children who are eligible for free or reduced lunch, and our rates are at 59%, which is higher than the Wisconsin rates. And then this is the number of food share recipients in Waushara County, and the numbers are increasing even though the population size is decreasing. And our goal is to increase physical activity and improve access to adequate, appropriate, and safe food and nutrition in Waushara County. Our action plan is to increase the proportion of low-income residents who have access to food outlets, and to facilitate and support the development of new, safe, affordable, and culturally appropriate physical activity. We also plan on contacting worksites that employ over 100 employees to ask if they would like to have a wellness plan developed. And we also plan on contacting the schools to help them develop a plan for managing children with chronic disease like asthma. And we would also like to increase the number of healthcare professionals who are involved in the Wellness Coalition. So what we have accomplished so far is we are trying our best to support and promote community health efforts in Waushara County. In October, we volunteered at the Reach the Peak Run and Walk. And in February, the Watoma Health Department will be collaborating with the Watoma Area School District, the Watoma Healthy Communities and Healthy Youth, and the Prevention Council to hold a second annual Family Fun Fitness events on Saturday, February 15th at the local high school. And then the Get Active Guide is what we have here. We are trying to distribute that in the community, and the guide just has information on where people can exercise and then how they can exercise in Waushara County. It also has information on the the farm stands in Waushara County and where they are located. And Vision 2020 is redoing the farm stands in Waushara County, and the new list will be up in the Waushara Visitors Guide, and it will also be up on their website, and they will also have a flyer on the farm stands that they will give to residents. So to conclude, everyone is welcome to join us in making Waushara County a healthier place to live, work, and play. And if you want more information on the CHIP, you can always come to the health department and ask for the paper copy, or it's up on our website, and we also have brochures for you guys. Does anyone have questions?
Thank you very much.
Thank you.
Okay, now we're going to go on to the discussion of possible action items. Number one is the 2013 wage adjustment for Waushara County SEIU Healthcare Wisconsin Association. And Deb, I think that's you.
Sure. This is one of the groups that's in limbo right now until the Supreme Court
makes all their decisions about Act 10 and the constitutionality of Act 10. And so the WRC has put all the elections on hold. So this particular group is our nurses group. They are with SEIU. They have every intention of certifying as a union. But again, the WRC is not, they are not conducting any of the certification elections. So we have 2013 is coming to a close very soon, and so I guess what we're asking is that we extend the 1.5% wage increase that we had given to everyone else to that particular group. It gives us time to process it in 2013 to get the retirement caught up in 2013. This group does pay their employee share of retirement. They are under our policies for everything else. It's just that they haven't gotten a raise. And so we're asking that we fix that. We won't have an official contract with them, but they've signed off on the 1.5% for 2013. And so when they do certify, we'll go into 2014 and start talking about what we do with raises. One of the reasons you want to have this done in 2013 is that when you do the retirement, when you pay in that retirement, if you don't do it in the year that it's earned, so if in 2014 we go back and do a lot of retro pay, you pay interest on that money. And it's not a significant amount of money, but there is some cost there.
5% increase.
Motion by Pat, second by Everett. Is there any other discussion? All in favor?
Aye.
Opposed? Same sign. All right, next is the approval of the Civil Rights Compliance Letter of Assurance. That's you.
That would be me again. All right. So the state requires that every 3 years you put a plan together, and so our last plan will end on December 31st of 2013. They just recently put the requirements out, so they didn't give us a lot of time. The letter of compliance has to be submitted to them by January 3rd, so this was our chance to get that part of it done. They give us until about the middle of February to do all of our program analysis, so we have to go through each program that receives federal funding, and we have to do an analysis to make sure that we are meeting the percentage-wise, it's affirmative action, so that you look at your population base. So if 92% is white and 1% is Indian and 3% is Hispanic, you want to make sure that you're serving that group also. That's what affirmative action is all about. So we have to do this program analysis on each program that gets federal funding. And so, but I do have until the middle of February to get that part done. We also have to do a self-assessment where we go through all of our buildings and all of our properties to make sure that it's accessible, and we're doing all the ADA requirements. Because this isn't the first time we have to do the assessment, but because it isn't the first time, I'm not expecting any surprises. We haven't changed a lot of buildings, so I don't have a lot of notion that there'll be surprises there. But this is the first step, is really the letter of assurance. And so if you notice, this is all the laws that are referenced that we have to abide by. And the list is pretty endless. Luckily, I did not have to research this. The state gives us this form and says, "Here, this is what you got to do." So they're the ones that research it all. And so basically, this is just taking their information and putting it on my letterhead, and then Lucky Donna gets to sign it. So, and this has to be sent in by January 3rd. So it's just the first step of it.
Motion by Everett, second by Bob Waito. Do you have any questions or comments? All in favor?
Aye.
Opposed? Same sign. Next, we have consideration and possible action on the following resolutions.
Resolution number 49-12-13, resolution authorizing the increase of hours of the casual part-time position in environmental services within the Waushara County Health Department as a part of the Tri-County Environmental Health Consortium.
Okay, and that would be Patty. Do you want to say a few words?
This would be Ashley Rondor. For those of you that are familiar with Ashley, a year ago I asked for 600 hours. I'm asking that to be increased up to 1,200. I only anticipate using 900. That would be best for my budget to stay to 900. That's what we plan on doing. With Ashley's help, we were able to meet 100% of our facilities this last year. We just completed our audit with the State Department on Friday. We did our follow-up report with them, and they would like us to meet 100% of our re-inspections, which we don't do that, but we would. I see Everett laughing because the State Department doesn't do that either, do they?
They never did.
No, they never. They normally don't meet 100% of their inspections either. But their rules are different for us than they are for them. So we should hopefully be able to do that with that little extra help too. And Ashley does a fine job. It puts her at about 2 days a week. She's experienced, and we don't get any complaints. So it fits well within the budget. Doesn't affect the tax levy because the food program is one that's fee-based, and so it's all based on fees. So.
Motion by Everett to approve. Okay. Second by Bernadette. Any questions?
All right, Mr. Heisey.
Yes.
Mr. Tim.
Yes.
Mr. Piaski.
Yes.
Mr. Eckstein.
Yes.
Mrs. Plata.
Yes.
Mr. King.
Yes.
Mr. Wadle.
Yes.
Mr. Crawford.
Yes.
Mr. Kirsch.
Yes.
Mrs. Prince. Yes.
Thank you.
Resolution number 50-12-13. Resolution authorizing cancellation of outstanding checks, County Treasurer.
Motion by Larry Crawford. Second by Everett. Any questions? All in favor? Opposed, same sign.
Resolution number 51-12-13 regarding opposition to Senate Bill 349 and Assembly Bill 476, limiting local control of non-metallic mining operations.
Motion by Bob Wadle, second by Larry Crawford. Do you have any questions on this one? All in favor?
Aye.
Opposed?
Resolution number 52-12-13, reorganize Department of Human Services staffing model.
Is Glenn out there? No. Okay. I guess you're stuck with me again. Glenn had asked that we look at, he has 2 positions on the current organizational structure. One is the home care aide and the other one is the case manager specialist. And he basically has them both doing the same work. And so what he would like to do is have them titled, both of them titled case manager specialist, and have them both on that spot on the pay scale. It is a higher cost than the home care aide, but he has them doing the same work and is asking that they be handled the same.
Okay, thank you. Motion by Bernadette. Second by Pat King. Any questions? This is an I no vote.
This time, Mr. Tim.
Yes.
Mr. Piaski.
Yes.
Mr. Eckstein.
Yes.
Mrs. Plata.
Yes.
Mr. King.
Yes.
Mr. Wadle.
Yes.
Mr. Crawford.
Yes.
Mr.
Yes.
Mrs. Prince. Yes. Mr. Heisey.
Yes.
Thank you.
Resolution number 53-12-13, resolution supporting Assembly Bill 429, requirements for marriage officiants.
We have a motion. Motion by Pat King. Second by Everett Eckstein. Do you have any questions or comments? All in favor?
Aye.
Aye.
Opposed?
Resolution number 54-12-13, resolution supporting Assembly Bill 418 and Assembly Amendment 2 to Assembly Bill 418 regarding adjusting recount fee structure.
is in our packet as well. Do we have a motion? Motion by Bob Radel, second by Larry Crawford. Are there any questions or comments? All in favor?
Aye.
Opposed? Seeing none, we have some appointments and nominations. First one is Board of Health, Donna Goldsmith, Watoma. Her term will be January 2014 through December 2014. And Bethel Sika, she is an RN. She's from Wild Rose. Her term is January 2014 through December 2016. And Dr. Gilbert Stephanides, Wild Rose. His term will be January 2014 through December 2015. Then we have East Central Wisconsin Regional Planning Commission nominating Neil Strelo for a gubernatorial appointment, and that's a 4-year term. And Veteran Services Commission, Patrick Fox, Watoma, term January 1st, 2014 through December 31st, 2016. We'll do them all in one motion. Motion by Everett, second by Bernadette. Do you have any questions or any comments? All in favor?
Aye.
Opposed, same sign. Do you have any suggestions for future agenda items?
I have a question referring to the Fitch study survey that was done this past year. There's been some discussion at our Town of Leontown Board, Town of Poisippi Town Board, and the Fire Department in Poisippi about the status of the ambulance service for Waushara County. I'd like to get an update on that. If we have information tonight, fine. Otherwise, put it on the agenda for next month for an update on what the plan is for the ambulance service for Waushara County.
I can share with you that at the last public safety meeting, the whole organizational structure of that had the discussion, and that was delayed until after April, if I understand correctly. So it's just status quo for right now.
Thank you.
That will give us time to gather the information that we need to make a decision. And Jeremy will be acting director. Jeremy, last name? Becker will be the acting director until a decision is made. Right. Motion by Everett to adjourn.
Second.
Second by Larry Tim. All in favor?
Aye.
Opposed? Have some cookies if you'd like to.
Really pushing them cookies, isn't she?
Melanie,
Huh?
you'll give me a call if I've messed up on any of that?
I will. I took a quick
Coming over to
glance.
pester me now.
Boy, will she give you a
now.
call.
I didn't
And
have this.
if you have to, just forge my name.
About that sale.
Whoa! This is getting better all the time.